Welcome back to Dentistry Q&A. Today we're exploring Radix Entomolaris, an extra root on mandibular molars that can make or break your root canal success. Radix Entomolaris, Diagnosis and Endomanagement. Here's an in-depth breakdown of Radix Entomolaris, its anatomy, prevalence, clinical implications. What is Radix Entomolaris? The Radix entomolaris is an additional third root in the mandibular molar that was first described in the literature by Carabelli. The supernumerary root of the mandibular molars is distolingual to the mesial root of the mandibular molars in Radix entomolaris. Similarly, the Radix perimolaris is an extra root on the mesiobuccal side of the distal root of the mandibular molar. Definition: an anatomical variation featuring an extra root located distolingually on mandibular molars, most commonly the first molar. The buccal equivalent is called Radix perimolaris. First described by Carabelli, 1844, term entomolaris coined by Bolk in 1915. Prevalence and ethnic variation. General global prevalence, 3 to 5%, varying by ethnicity. High incidence, 5 to 30%, in Eastern Asian and Native American groups, lower, less than 5%, in Eurasian Indian European populations. Annual global CBCT studies report prevalence around 3% for first molars. Classification systems. 1. Carlson and Alexanderson, by cervical location. Based on its location of cervical part. Type A, RE is located lingually to the distal root complex which has two cone-shaped macrostructures. Type B, RE is located lingually to the distal root complex which has one cone-shaped macrostructures. Type C, RE is located lingually to the mesial root complex. Type AC, RE is located lingually between the M and D root complexes. 2. De Moore et al., by curvature. Type 1, straight. Type 2, curved. Type 3, S-shaped. 3. Song et al., population-based morphological types. Clinical significance. Extra roots increase risk of missed canals, leading to endodontic failure. Diagnosis. Take angled radiographs, 30-degree angulation, utilize Slob/Clark's rule. CBCT provides definitive 3D morphology. Access modification, shift to trapezoidal outline extending disto-lingually. Canal instrumentation, use small, flexible instruments example 6 or 10K files, needy glide path files, conservative shaping to avoid perforation. Magnification, loupe/microscope, and enhanced irrigation are essential. Final takeaway. Radix entomolaris is a small but significant anatomical variant. Miss it, and you risk endodontic failure. Diagnosing via angled radiographs and CBCT, modifying access for straight-line entry, and employing conservative instrumentation are essential recipes for success. If you enjoyed this deep dive into Radix entomolaris, hit like, subscribe, and share any challenging cases in the comments below.